It's David O'Leary and Sue Tabb from Magic 106.7. The Dimock Center is a Boston institution that has been around for a number of years. Since 1982, it was started initially as the New England Hospital for Women. It has grown to be much more. We're really happy to be able to share a little bit of their story by welcoming Dr. Holly O and also Raquel Rosenblatt from the Dimock Center.
The Dimock Center actually has this fantastic history. It was founded as the New England Hospital for Women and Children in 1862, founded by women physicians who weren't able to practice medicine elsewhere at that time.
Oh, wow.
We trained the first nurse in this country, who trained the first African-American nurse in this country. It was a really incredible founding. We became a community health center in 1969, and since then continued to add more divisions of care, including behavioral health and early education. So now we serve more than 19,000 people in a year, mostly very low-income people from our community, but also folks from all parts of the state, especially who come for our substance use disorder treatment.
We actually have a 9-acre campus in the heart of Roxbury, and actually we have a whole variety of, it's a health and human services organization, because Dimock, and what we believe is that health is not just physical health, right? So it's physical health, we have health services, we've got a whole behavioral health and addictions programmatic arm, and then we have early childhood education as well, because we really do feel like health and wellness is really about physical health, it's about your behavioral, emotional health, and it's about all these, whole person care. And so we've really sort of created our model of care to really help patients and families with that whole person care.
A large portion of our funding does come from federal and state and local grants and contracts and patient reimbursements. We have a really robust fundraising program, which I'm really grateful for, incredibly generous donors and supporters and corporate partners.
One of the most important things that we believe at Dimock is that we take care of the whole person, the whole family, regardless of ability to pay. We work hard to make sure that access is good, and we try to connect people and families up to the care they need when they need it, right? So they may come in to primary care, right? So adult primary care, pediatric primary care, but the overall health system is not that easy to navigate. We've tried to create our systems at Dimock so that no matter what door you're entering in, if you're coming in the primary care door, well, gosh, if you need behavioral health services, we've got that right there. If your child needs early Head Start, preschool, we can make that connection really easy. Because we know that sort of big health systems are not easy to navigate, especially for people who may be of limited means, maybe don't speak the language and so forth. So we've tried to make it as easy as possible to connect people up to what they need when they need it.
We have a really fantastic volunteer program that welcomes individuals and groups and companies who come for service days. There are also opportunities for folks to even just read in a classroom with children, which is really significant. So there are lots of different ways for people to get involved.
We see amazing stories, life-changing stories happening every single day.
Visit our website, www.dimock.org.